Hi guys, welcome back to my channel and thank you so much for watching. Right, so in today's video we're going to be talking about the highest paid nursing roles in the UK. But before we go into that, I just want to explain how the agenda for change pay scale works. So agenda for change pay scale is basically how nurses who work in the NHS get paid in the UK. So a newly qualified nurse will be working at the lowest point of a band 5 with a starting salary of about 28,407. And as you gain more experience and gain more skills, you can move up the scale and then apply for more senior roles, which will be like your band 6 to band 8 roles in the NHS. Also, please bear in mind that a lot of the roles I'm going to be talking about today, your average salary as a nurse in the UK will depend a lot on your location, because if you work in London, you're going to get paid more compared to a nurse that's working in the East Midlands or in other areas of the country. And that's because places like London will have a higher cost of living, therefore they have to pay more. Also, other factors that can influence your average salary will be things like your years of experience in the job and also your working pattern as well. So people who work nights and weekends get paid enhanced rates. So technically they will get paid more compared to someone working 9 to 5. So these are all factors that will determine how much your average salary will be. But for these jobs, I'll give you an idea of how much you could possibly expect to be earning. But please bear in mind that there might be additional requirements that you would have to meet before you are considered for this role. Right, so without wasting much time, let's get into the list. So the first job on my list today is the nurse endoscopist. And to become a nurse endoscopist, you need to be a registered nurse in the UK. Have completed your postgraduate training to become a nurse endoscopist. You need to have completed all the clinical competence. You need to have gained experience, knowledge and skills in endoscopy procedures. So nurse endoscopists are usually involved in a lot of endoscopy procedures like your colonoscopy, your upper GI procedures. They are involved in rectal examination. But for a nurse endoscopist, usually they start off as a trainee with a salary of 35,392 to 42,618, and then as they gain more experience and skills and then become qualified to be able to work independently as a nurse endoscopist, they can move up all the way to a band 8A with a salary of 50,952 to 57,347. The next job on my list is the advanced clinical practitioner. I've also done a whole separate video explaining the role of the advanced clinical practitioner, how to get into the job and how the whole process works. So definitely check out that video. I'll try and link it somewhere in this video. But basically, advanced clinical practitioner have a lot of extra skills, knowledge, experience that they need to be able to assess patients. So when a patient comes into the hospital, as an advanced clinical practitioner, you need to be able to assess the patient, manage the patient's condition independently, interpret scans, prescribe medication for the patient, decide on patient management. And in terms of salary, usually a trainee advanced clinical practitioner will get paid as a band 6 with a salary of 35,392 to 42,618. And as they gain more knowledge and experience, they then progress to a band 7. And then by the time they qualify as an advanced clinical practitioner, they'll be working as a band 8A with a salary of 50,952 to 57,349. The next job on my list is the clinical nurse specialist. So that includes your diabetes nurse specialist, your pain nurse specialist, tissue viability nurse specialist, infection control nurse specialist, COPD nurse specialist. There's a lot of nurse specialists. So basically your clinical nurse specialist role means that you're specialized in a specific condition or a specific area. So for instance, in a respiratory nurse specialist, we have extra skills, knowledge and experience in looking after patients with respiratory conditions. And clinical nurse specialists usually start up as a band 6, and then as they gain more knowledge and experience and possibly do some extra courses, they can move up to a band 7 with a salary of 43,742 to 50,056. So again, they're highly paid, but you need to consider that for a lot of this role, you have to work hard at your professional development. You have to make sure you get extra knowledge and extra skills to be able to move up the ladder. The next job on my list is your ward managers or ward sisters. So this includes your deputy ward sister, your deputy ward manager, and basically ward managers or ward sisters are involved in running the ward on a day-to-day basis. They're involved in patient safety, staff management, doing rotas for the ward staff, training junior colleagues, teaching and educating staff members. They're involved in ward round. They do quite a lot, but basically they're involved in running the day-to-day activities of the ward. So they provide clinical leadership on the ward on a day-to-day basis. And usually you start off as a deputy ward sister or ward manager, as a band 6, and then as you gain more experience, skills and more knowledge, you can then decide to apply to become a senior ward sister or senior ward manager at a band 7. So the next job on my list is the nurse consultant, right? So nurse consultants can manage their own caseload. They can basically manage their own patients from the moment the patient comes in the door until the moment the patients are ready to be discharged from the hospital. They need to be able to assess, manage, diagnose, treat patients independently, and they form part of the senior management team. But as a nurse consultant, you get paid as a band 8A, the salary of 50,952 to 57,349. The next job on my list is the research nurse. So research nurses are involved in auditing, they're involved in data analysis, recruiting patients for research trials. They're also involved in using a lot of research methods for clinical trials. Research nurses usually get paid as a band 6, and as they gain more knowledge and experience, they then become a band 7. The next job on my list is occupational health nurses. So occupational health nurses are involved in immunization. They make sure that staff have the most up-to-date vaccinations. They are also involved in inoculation incidents, so things like your needle stick injuries, and they do a lot of risk assessment for staff members. But usually they start off as a band 6, and then as they gain more knowledge, experience and more skills, they can then progress to a band 7. The next job on my list is nurse lecturers or nurse educators working in the NHS. Usually get paid as band 6, and then as they gain more knowledge and experience, they progress to band 7. And to become a nurse educator, you need to be able to teach and mentor other people. You also need to be dedicated to your own professional development, because you might be expected to do some extra postgraduate courses that are related to teaching and mentoring others. So you can work in the universities as a nurse lecturer, basically teaching people how to become nurses. Clinical nurse educator get paid as a band 6, and then as they get more experience, knowledge and skills, they can then move up to a band 7. So I think it's definitely worth it. I think it's something you should definitely consider. Let me know what you think actually. Which of these roles would you consider going for? Let me know in the comment section below. I absolutely enjoy doing this kind of videos for you guys. Thank you so much for watching. Please don't forget to like, subscribe, share this video as well. It will truly mean a lot to me. Thank you so much for watching, and I'll see you in the next video. Take care. Bye-bye.